I'd like to introduce our next speaker, Natalie Tuckey. Natalie is a qualified psychologist and holds a Master of Psychology from the University of Adelaide. She is actively working towards her endorsement as a health psychologist. Natalie's expertise lies in the intersection of mental health and chronic illness management, with a strong focus on improving the quality of life for individuals living with long-term conditions. She is passionate about the role of mental well-being in enhancing the overall care experience for those facing chronic diseases. Natalie is currently pursuing a PhD with the University of Adelaide and Supportive Oncology Research Group at SAMRI, supervised by Associate Professor Hannah Wardle, Dr. Matthew Iasello, Dr. Melissa Cantley, and Dr. Katina Ali. The research is focused on improving the mental health and well-being during supportive cancer care for people living with myeloma and precursor conditions. And so without further ado, I'd like to introduce Natalie.
Thanks, Kat, for the introduction, and hello, everybody. I'm really excited to be here today to be able to share a little bit more about the research that I've currently been doing, and to provide some more background about what supportive care looks like and how mental health and wellbeing is really important in that space. So from my presentation today, I'm hoping that you'll come away with more understanding about what supportive care looks like, how mental health and wellbeing is really important during this part of living with myeloma. And I've got a short wellbeing activity at the end, how we can use our values to help navigate supportive care. So we'll get right into some definitions about what supportive care looks like. Over the decades, there's been lots of advancements in technology and treatments. But what that means is that people are, living longer, which is great, but they're living longer, I guess, with side effects and symptoms of the disease as well as the treatment. So that's why supportive care is so very important. The definition can vary according to different professionals, but ultimately, it's about the prevention, which is really important, and the management of the adverse effects of the cancer itself and the treatment. So supportive care is really about how do we alleviate some of the symptoms and side effects of, the nasty things that you're kind of having to live with the treatment and the cancer itself, and ultimately improving quality of life. And for everybody, that's incredibly different and unique. Depending, on your age, your social environment, the things that you value most, it's really about making sure that you're doing the things that are important to you for as long as possible. And it's looking beyond the active parts of treatment. So, if you're not in an active phase, for example, then that's still really important of your supportive care, so that you're still doing the things that are important to you and you're managing well during that period. It's not just about when you're actually having active treatment. And ultimately, it's about enhancing your mental well-being. So just get my slides organized here. So in the context of supportive care, I wanted to introduce it's called the biopsychosocial model, which is developed by George Engel, and it offers a holistic approach to the relationship between physical health, so physical illness, and mental health. It's something that health psychologists really focus on because it really acknowledges the interconnectedness between, physical and mental well-being, as well as the social structures in which we live in. It can be really helpful to recognize that cancer isn't just a physical disease, and it's really influenced by the psychological and social elements. And you can see on the model here that encompasses those three aspects, which all overlap, which means they're all interconnected. So to go through them briefly, the biological component we're probably more familiar with, which is anything to do with physical symptoms like pain and fatigue, things affecting your sleep, the physical changes to your body like muscle loss, some of the nasty side effects like diarrhea and constipation and different types of pain, for example. But the biological components also include how you personally react to those side effects and treatments, that might be relating to your age, your immunity level, for example. So it's all those sort of physical, biological components, which is really important. The social factors refer to our social environment. So this includes access to healthcare services. We've already heard a few comments today about living in a regional or remote area, or if you don't live very close to where your treatment team is. So having access to qualified professionals makes up a big part of that social element. And that's not just about your hematologist and myeloma nurse, it's also the allied health supports that you might be interested in or really used for your complementary care, for example. And navigating, navigating the healthcare system would fall into that as well. And then the last little circle there is the psychological factors, which really relate to, how we experience the disease itself, the emotional effects. And I'll go into this a little bit more later in the presentation, with the ups and downs, which happen with myeloma. There might be, feeling anxious or fearful, but you also might feel, some optimism and hope as well. And these can all influence, I guess, the biological factors in terms of, how you're experiencing the symptoms themselves and how you relate from a social perspective, which I should mention also includes our social support. So, your myeloma support groups, your family and friends, for example, your community. So all of these factors really affect your experience with living with myeloma. And I've got a quote here from someone I recently interviewed, and I'll be using quotes throughout this presentation to really highlight how individuals are experiencing this. I'll try and read it from here. So there's one thing that worries me a bit, because with men, we tend not to sit down and chat. We've got to be doing something. I'm with a group that did bushwalking 4 or 5 times with a heavy pack. And the last time I did that, I really struggled to get into the camp in the evening and I knew something was very wrong. I've now gone back on long walks and I can walk with him for an hour on Friday mornings. I go bike riding with another friend, and at some stage, I'm worried that if I can't do those things, and that friendship group will fall away. I still catch up with half a dozen people for coffee every now and then, but I'm worried it won't be the same as regularly getting together with people for physical activity. I suspect it's coming to an end at some stage. So you can see that quote really demonstrates how, the physical aspects of the disease is potentially going to impact that social element, because it was previously connected through, physical activity, and that worry and that, fear of uncertainty is kind of playing out. And that's just one example, I guess, how it demonstrates the interconnectedness of our physical, our social, and our psychological aspects. So I wanted to then focus on this model. This is a supportive care framework presented by Margaret Finch. So this presents supportive care into a few more categories, which I think is really helpful for people to identify where are the gaps. Where are the gaps in my supportive care? What's missing? What are the things that are important to me that I still need support with or want to maintain that support? And just want to highlight that the circle in the middle is you, and everybody is unique and individual. So whilst I'm providing some generic examples, it's really about what's important to you. You can't compare yourself to others or have a one-size-fits-all in our supportive care. So I guess like the previous biopsychosocial model includes psychological, physical, and social. So I won't spend much time talking about those now, but I did want to highlight the other areas of supportive care. So I'll start with the practical element. So the practical needs, just trying to work out what's on the slide there. So the practical needs of someone living with cancer might be the logistics of getting to and from their treatment. So, whereabouts is your treatment located? How many times do you need to go in to have your treatment? Do you need to be there for a long period of time? Other practical matters like the financial stress of managing healthcare costs or stopping work, for example. So access and navigating the healthcare system. That's really the practical elements of your supportive care. And I've got a quote here to demonstrate an individual who's, it's two individuals that demonstrated this. So most of the practices now here are not bulk billing, they're mixed practices. So unless you've got a healthcare card or something like that, you have to pay every time you're going in, which is more and more money. I was driving 80 kilometers to get to my medicine, to get chemo and everything. So you can see here that the financial and the transport element of living with myeloma is creating a significant burden for both of these individuals. The next area that I wanted to focus on was spirituality. And this refers to an individual's, I guess, search for meaning and purpose and connection to something bigger than themselves, often involving transcendence or a belief in a higher power or, a deeper reality. Many people, facing cancer often are faced with their own mortality, sometimes for the first time, and they're having these sort of thoughts about why is this happening? What does it really mean? So some people, for spirituality is an incredible, important part of their supportive care. And it doesn't have to be a religion. It could be about just searching for meaning or being part of or focusing on sort of a higher purpose, for example. And some examples, I guess, of spiritual practice might be through meditation, prayer, mindfulness, connecting with nature can still be spirituality, and being, connected with creative activities like the arts and music, for example. And I've got a quote here from an individual. So I'm not sure what I believe in that respect, but I do believe very much that there is somewhere else to go because of the things that have happened with when my mother died. I feel like, well, if I'm going to go, I'm going to mum. So I talk to her every day anyway. And the last element I wanted to mention, actually, no, it's not the last one. Another one I wanted to mention was the informational needs. So we hear time and time again that, there's information overload, like a lot of complex, difficult information to navigate. And for many people, this is a huge part of their supportive care, to feel like they can be part of the conversation or to be, actively involved in their care. They really need to understand and digest some pretty complex information. So navigating, the medical terms and the terminology relevant to you is really, really quite challenging for most people. Information, I guess, supports relate to not only the conversations you're having with your treatment team, your doctors, your hematologists and nurses, for example, but it's about accessing, having brochures given to you, knowing where to go online, going to the Myeloma Australia website, navigating their services, joining an online social group and going to a social forum or even conversations with family and friends. So information can actually come from multiple places, not just your treating team. But I think we can all acknowledge it's a huge part of the supportive care environment. A couple of quotes here to demonstrate this. I guess you know that what services you need. Sorry, I guess you don't know what services you need. It's a very new environment to have cancer, but then also to understand what your cancer means and then how it affects you individually. I had to learn to figure out what's there because there is so much support when you know where to get it from. And the second quote there is, I'm an expert on me. I would like to be a partner on that journey and be listened to and supported on what I need, but also have the expertise available so that the person who knows the most in the room, being the doctor, can have that conversation, but in a way that I understand. I don't want to be talked to in jargon. I don't want to be talked down to. I'm capable of having that conversation. I just might need to have it 2 or 3 times while I digest it, but I want to be supported through that. I think that's a really lovely quote that demonstrates the, wanting to be really involved, but just needing a bit more time to really understand what is very, very complex information. The last element I do want to refer to, and I have briefly mentioned it previously, is the emotional support that people need. You know, there's huge ups and downs, depending on where you're at with your diagnoses, with your with the physical symptoms, for example, and it's a huge roller coaster, and everybody's going to be experiencing it very differently. You can have some really raw, strong emotions like feeling rage and anger, or grief that goes part of it, or you might be feeling quite optimistic and hopeful, and you will have these waves, and it might all be happening at the same time. But I think this is a really important factor with supportive care, and that it needs to be present in all aspects in your conversations with your doctors, with the people around you. So feeling like you're emotionally supported, I think, is an incredibly important part. And I've got a brief quote to mention this. So I guess you have to constantly think, oh, well, there's something else is going to happen. But the treatments don't just come along with no side effects. You have to take stupid steroids and everything around them. And that's just what makes you feel gross and horrible. And so, yeah, there's the next line of treatment, and how's it going to make you feel? What new lovely side effects are you going to have? It's just not fair. I'm angry. So this is a quote from someone that I recently interviewed, sort of expressing how they're kind of feeling about the potential of relapsing. So, as I've kind of mentioned through, supportive care frameworks, and I've kind of presented them quite in a simple way, but honestly, it's not a simple process. It's difficult to navigate, and there'll be lots of ups and downs along the way as you navigate these changes, throughout your progression of the disease. And it will really depend on, how much you want to be involved, how much information you want. So there's going to be lots of unique factors a part of this. But one thing that is important is this concept of self-advocacy, which refers to, your behaviors in getting your needs and your values met during this process. So this might look like in terms of, asking more questions or doing more research or, joining some, myeloma support groups or, watching these webinars, for example, making it clear what your gaps are, what are the things that are not going well for you, or some of the things that are going well as well, just to sort of keep that conversation going. And being more involved in your care can have some positives. You can see an improvement in your well-being or physical factors by being proactive, just noticing a symptom to start with and going, right, I'm going to get on top of this before it becomes too much, and sort of feeling comfortable to do that. And having a sense of autonomy about your own experience, for example, because you're the only person who knows what you're feeling and what your needs are. So that's really important. However, when I was, speaking to people about the self-advocacy component, this can be a really, really tricky part for many people. This is not something that comes naturally to most of us, in a new kind of, environment where there's lots of terms that you don't understand. So I've got a couple of themes, I guess, that came out of those conversations about what might get in the way, of being able to advocate for yourself. Some of the comments were around my issue's not that important, sort of minimizing the fact that, oh no, it's fine. I can live with this. It's not a problem. I don't want to upset my doctor, which came out a little bit in terms of I don't want to challenge my doctor or come across as of not agreeing with their approach, for example, if they didn't see it as being a big issue. I don't want to waste my doctor's time. You can see how busy he is. We all know the time pressures of like needing to get information out. And I think the previous presenter, Jackie, talked a lot about going in with a list, but this sort of came out in the interviews about, oh, I don't want to be seen as, someone who's wasting his time or her time. I don't have enough information yet. Feeling like they can't contribute to the conversation because that information's not there. That's my doctor's job. They know more than me about myeloma. Surely my doctor will mention it when the time is right. I don't want to be seen as needy. So these are the comments that came out, for people when we're talking about how do you get your needs met. So I guess in terms of the challenges that people are experiencing is, feeling like they need to understand the diagnosis more before they can speak up about their needs, how they engage with their treatment team, the relationship, the rapport they have with their hematologist, their GP and nurses. Making your needs known, sort of feeling like you can do that, being open for asking for help. This can be a huge barrier for people, wanting to sort of say, actually, I'm not coping, I'm not doing really well, which is really hard for many people. And then that confidence to speak up in a really unfamiliar, environment that you may not be used to. So this is where I guess mental health plays a really big role. Navigating all these challenges is absolutely complex and can be really hard for many people. And as I've mentioned, bring up a huge range of emotions. So mental health is defined as a state of well-being that enables people to cope with the stresses of life, realize their abilities, and learn and work well. So it's about feeling resilient, that you feel like you've got the skills and the ability to cope with those challenges that are ahead of you. So mental health awareness and education can help us to cope with those emotional ups and downs. And it's normal to have ups and downs, but sometimes they can become too much, or they start to interfere with our normal day, for example. So I'm just going to go through, I guess, 3 simple factors which we should be thinking about with our mental health to keep us mentally well. And the first one is managing our emotions. Like I said, it's normal to have ups and downs, but if you're noticing that you're spending, there's more time of your day where you're feeling really anxious, or you're feeling like you just don't want to do things anymore, the things that you used to do, that's a warning sign that you're not coping and that things aren't going so well, that you actually need some help. So it's what strategies have you got to be able to manage those huge waves of emotions that come and go. The next one here is social connection. So it's really important for us to feel emotionally supportive, feel like we're part of a community, which I think is really lovely from the support groups that you might be part of, to be able to share those common experiences, maybe vent, along the way, but feeling emotionally supported by, your loved ones, your treatment team, and being able to still be part of your community and not just be focusing on all the medical side of things. And then the last one I want to mention is about having meaning and purpose. So if your week is consumed by really heavy medical conversations focusing on the treatment, that can be problematic. You kind of want to have it more of a balance about, right, okay, yes, I've got to deal with that, but what are some of the things that are actually really important to me? What are the things that I want to spend my time on during the week without focusing just on my physical health? So reconnecting with the things that are important to us is really important. So, mental health and well-being, which is an area that I'm particularly passionate about researching, is growing. There's lots of benefits about focusing on your mental health and well-being during your supportive care. Managing strategies about your anxiety and depression, which might be significant, or it might just be mild. Building resilience and coping skills, and many more. My team and I recently were part of a research group which, trialed a mental health and wellbeing program in this space and saw some really lovely benefits. So there's lots more research coming in this space, and we know that mental health and wellbeing is incredibly important as you navigate, your supportive cancer care. Oh, I think I've changed slides. Oh, I'll go to this one first. So it brings me to I guess my well-being strategy. I don't know how I'm going for time, whether I'm over or not. So I'll try and keep this brief. But ultimately, our it sort of draws upon the things that I've mentioned about, balancing out the things that are really important to us. And often people will say, I want to spend time with family and friends or doing the things I love. But sometimes making a bit more pointed about, well, what am I actually going to be doing during that period? What are the things that I actually want to be doing? So connecting with your values allows you to be a bit more authentic in your life. And it's a way of sort of clarifying what are the things that are important to me, and step back and review kind of where you're at. An easy way of thinking about it is how do you want people to describe you? What qualities and strengths do you have that you want to continue to use? And I'm going to use some examples to help navigate supportive care, because that's what this is all about. But you can certainly go back and, rewatch this presentation at a different stage and think, well, what are the things that I actually want to be doing? And it comes from a therapy called acceptance and commitment therapy, where, you clarify your personal values and make a commitment to do things in a more meaningful way throughout your life. So it's about stopping, and on the slide there, I should have clarified, these are examples of different types of values, but it's really about how would you describe yourself. So I think I'll go back one slide there. So what I would get you to do, for example, is to pick one value that's important to you. As I mentioned, how do you want people to describe you? And it can help using categories. So with my family and friends, in my relationships, I want to be someone who's caring or compassionate, or I want to be funny, or whatever it is that, makes you whoever you are. And then you might be something different when you're looking at your health, or when you're looking at personal growth or leisure. Leisure, you might be more curious and, creative, for example. So you kind of want to pick a value that resonates with you. And then we create a goal, I guess, around that. So I'll just jump a couple of slides. So some examples I've got here. So a personal goal would be, I want to treat myself with self-compassion when I feel overwhelmed, and spend time in my garden, which is something that makes me feel good. So the value there would be self-compassion. Another example here is, I'm going to use the value of courage to tell my doctor how I feel. Because we know that people don't have as much confidence in this space. So using a value like courage means, right, I'm going to work on this, something that's really important to me. And then the last value I've got there is curiosity. I'm going to use my value of curiosity to ask my treatment team more questions and learn more about my diagnoses. So if there's one thing that you take away from today's presentation, it's that supportive care is tricky, and you shouldn't have to do this on your own. Asking for help, having the courage to actually say, you know what, I need some help with this, things aren't going so well, is probably the one thing that I'd like you to take away from today. In the big purple letters at the bottom, the myeloma information line would be a great place to start. If you've got a good relationship with your treatment team, your myeloma nurse, absolutely ask them. There are services across Australia which offer free counselling through the Cancer Council, I believe. If you want to speak to a psychologist, you need a referral from your GP to do so. But you can get support from your peer support groups, family and friends, for example, to say, you know what, I actually don't think this is working so well, I need some more help. So really asking for that is really important. And then, so I just want to, I guess, end on this slide. So it's kind of a whirlwind through supportive care and mental health, but I really wanted to sort of focus on those elements today. On the slide, there is a QR code to a survey that I'm launching today, which is about understanding more about the supportive care needs for people with myeloma, but also smoldering myeloma, MGUS, and the family and friends of people that support support people with those diagnoses is really, really important for us. So if you get a chance, complete the survey, which would be lovely. And I also want to acknowledge the collaborators who I work with. So Be Well Co, SAMRI, the University of Adelaide, and the Supportive Oncology Research Group as well. So yeah, hopefully, I don't know how I'm going for time. Hopefully I'm not over too much.
Thanks so much, Natalie, for that was such an informative session. Unfortunately, we've probably got time for one question. There has got one question come through. Our mental health and wellbeing is a really complex space, and knowing where and how to manage the resources and where they are available is just as complex. So you've given us, given our viewers some ideas on where to access resources and how to access them. Just wondering, someone's asked about spirituality and prayer. Where do they fit into the mental health and wellbeing components of healthcare?
Yeah, and I think it's a really good point. And I think in the research that I've done so far is that there does seem to be a gap in encouraging people to connect with their spirituality in some way or form. And I think it's almost like a topic that people don't want to get involved in. It's like I don't want to think about, the next phase of my experience, or I don't want to think about, the inevitable. So it's almost like steered away from. People don't want to talk about it, I suppose. And I think this is a really personal question for people. It's like, if you are a religious person, or if religion and prayer is important to you, well, then absolutely it should be encouraged. And it can absolutely bring benefits, but even if it's not, like I mentioned, it doesn't have to be about religion. It can be about just, being part of, thinking that we're part of a bigger universe. It's not just about the things that we see in front of us and the things that we can touch with our hands, for example. So I think it's a really important part of people's care, and it's just about navigating and finding the right people to talk to about this. I think it can be, looked away from some places, which is fine. And it's about finding people that you connect with and talk to. And like I said, it doesn't have to be religious. Yeah.
Yeah. Thank you so much, Natalie. And we really appreciate you sharing your time with us today and with our community. If anybody does have any further questions for Natalie, please make sure you pop them in the chat box, and we will endeavour to get back to you as soon as we can.